Hello, everyone. Welcome to your final session of the day. I am thrilled to be introducing the Patch program. My name is Amy Olenichek. I am the founder and director of Patch. So I have been patching for the past 15 years since the organization was born. I know many amazing people in this audience. It was really lovely to walk in and be like, oh, we're in friendly space. Um, for those that don't know Patch, real quick overview, we have youth, high school aged youth throughout Wisconsin. They do two things with us, two really clear things with us. One of them is they are in the practice of teaching healthcare professionals of all types, anybody who serves young people, how to better serve young people. They are the experts. They know what it's like to be a patient. They know what it's like to be a young person. They bring that expertise to all sorts of conversations. They also love to give feedback, thoughts, feelings about what we are all doing to serve adolescents. So we also have teen consultants that are happy to give their thoughts and opinions about the work you're all doing. If anybody wants to engage young people in anything that you're doing to serve adolescents to improve adolescent health, please reach out to us. Again, we have youth in all corners of the state. They are eager and ready to be involved. And today we have 3 youth from our Patch Green Bay Teen Educator team that are here for this last panel. And the panel will be facilitated by the amazing Kendra Block, who is our coordinator of that team and also of our teen consulting program. So please feel free to reach out afterwards to myself or Kendra if you want to partner further. I think that is all from me. I'm going to hand it over to Kendra.
Thank you, Amy. It's so weird hearing myself. Wow. Okay, so I'm Kendra. I am the teen educator coordinator for Green Bay, and these are my 3 lovely youth. We are a team of 7, though, so I'm really grateful that you guys are giving them a space to speak on their experiences. Also, pronouns, right? She, her, and I have my little pin, which they're very cute. And then this is my first time doing a panel. Some of the youth have done other things, but just have grace. I think we got this. Also, we've practiced. Hello. So we have little scripts here. But at the end of the day, we're speaking from our heart. Or they are speaking from their heart. So yeah, I'm going to hand it over to our young people.
Okay. Hi. I'm Neela. My pronouns are she, her. I'm a junior. And I've been with Patch for 2 years.
Hi, my name is Ella. My pronouns are she, her. I am in 10th grade and I have been with Patch for 1 year.
Hi, I'm Gianna. My pronouns are she, her. I'm a sophomore, and this is my first year with Patch.
Awesome. So we're going to get right into the questions. So for the first question, we are going to get started with introduction questions. And this one is, when it comes to sexual health services, what makes you immediately trust or distrust a clinic?
Yeah, so I guess for me, when I first walk into a clinic and I automatically feel like there's kind of like a weird energy or that they already have a perception of me, maybe from like the way I look or the way I dress or something like that, it can kind of make me feel more like closed off and like feel like people are judging me, kind of.
Thank you.
I think, from my personal experience, I think when the visit is treated more like a procedure and like you're just following a checklist and more like we're not people, I think having more emphasis and trying to like make a connection with who you're talking to, even if it's more of an acute care, because going to an STI clinic, it might not be like long-term care, but still trying to make that connection with who you're visiting and not just like going through a procedure.
That was great. Thank you. 100%. Next question is, what rumors or myths about STI clinics do youth believe?
I think, at least for all 3 of us, the first thing that would come to mind is that your parents are going to be told or someone's going to find out. I didn't even know that STI clinics were a thing. It's not really something that you talk about. And so I think well, first off, hearing STIs, that's like a very personal thing. And I think along with that, since it's in healthcare, a lot of the time it's assumed that your healthcare information is going to be told to your parents, since that's who usually handles like the insurance paying for it, all that stuff. So I think it's going to be like the first thought of going there is that my parents are going to find out, and I don't usually want that.
Thank you.
Yeah, I completely agree with what she said. And another thing I would like to add is I don't really know if this is a myth, but when I hear like STI clinics, I know me and a bunch of my friends just kind of think like maybe if you go, like it's gonna hurt or something like that is gonna happen because we don't really know much about it. So
100%, a little intimidating is what I hear. Thank you. The next question I have is what's one thing adults or providers often get wrong about youth and sexual health?
I think that adults assume teens have a certain amount of education about sexual health, but we are all learning different things, and we might have way more or way less information than you assume we do. All schools are teaching something different. You just never know.
Thank you.
I think a lot of the time, teenagers can be seen as reckless in many things that they do, especially in things like regarding sexual health. So I think a lot of the times there can be assumptions behind what we do. And I think just like not having those assumptions because it's not like we want to get STIs or get pregnant, and we do try to protect ourselves as much as we can with what we know, but we're still kids and we're still learning and we're still figuring out how to do things the right way.
Thank you.
yeah, kind of along that line, I think just a lot of kids assume that if they were to get a STI, like people are gonna judge them and stuff. So just to be like kind of sensitive on the topic and not make it feel any way that you're like closed off or like why would you do that type thing.
Kind of like judgmental.
Yeah.
Yeah.
Definitely the assumptions, especially the assumption that everyone wants to be doing or partaking in sexual behavior, wants to do it, because there's a lot of pressure nowadays. And the reasons we may choose to be sexually active can be complicated. Um, for many teens, it's not necessarily something that they want to do for fun in their free time. Just remember, it can be really complicated, sensitive, and just really hard.
Thank you for touching on that. Next question. Let's talk about contacting youth and getting them into the clinic. So, this question is what turns you off immediately when you see a clinic's ad, text, or social media post? Which I know you guys are on Instagram, so.
Yeah, so when I see a lot of clinics like posting about their clinic or trying to appeal to a younger age audience, I always see them kind of like trying to make like jokes or something like that, or like some I know they're trying to be relatable, but it comes off sometimes as like kind of cringy and stuff like that. So if I were you guys, I would just try to make it kind of just more normal because that's gonna reach an audience way better than if you're trying to be like hip or something.
I think a big part of it is anything like trying to scare you into it. Already going to an STI clinic is going to be a scary experience. It's not going to be something like you're, oh, yes, let's go to an STI clinic. It's going to be scary and you're going to be nervous about it. So seeing posts that like have a fear factor to it isn't going to make me want to go anymore.
100%.
For me, the first thing I do when I'm scrolling on Instagram and look at a post is look at the comments because I want to see what other people are thinking and feeling about the certain thing. So, negative comments definitely can discourage us from getting the care we may need. But yeah, comments are a big thing.
Right, because it's almost like they're sharing their experience.
Yes.
Yeah, thank you. Okay, so the next question I have in this section is what gets in the way of youth accessing care when they want to?
I think a big part is transportation. I'm still 15, so I couldn't even drive myself here. I had to come here and get picked up from school with Kendra. So I'm not able to drive myself anywhere. And I think if I'm gonna have to ask someone to take me here, that's already gonna remove a part of like how I want it to be confidential and private for myself. So I think just even getting there in the first place is a big like roadblock to get around.
Thank you for sharing that. That is so huge.
For me, I think not having support, because unfortunately, sexual health is definitely political. And teens might be scared of what their parents may think, politically about sexual health. Um, so they don't even want to try.
Kind of like turned off by the idea because you're like a little like, I don't know. I'm already hearing this in the back of my head and at home. So
Yeah, parents definitely have a big influence on our decision making.
thank you, Neela.
Yeah, I totally agree with the parents thing. I think that's probably the number one thing that stops kids from accessing health because they don't want their parents to think there's something wrong with them. But also, I feel like a lot of teens like don't even want to go in because they don't want somebody to tell them that there's something wrong with them. So it's like it kind of goes both ways.
100%. Thank you. Okay. Let's talk about the arrival and waiting room experience. So, from the moment that you walk into the clinic, what makes you feel, I'm sorry, I hope you guys heard that. What makes you feel comfortable or uncomfortable?
So for me, my mom works at the place that I go and get healthcare services for. And she knows a lot of the people and including the front desk person. So the last time I in for my appointment, they were talking and making small talk. And my sister was there with me and we were just looking at each other like, because it can be awkward. Yeah.
I appreciate you sharing that. Yes.
I think like just the atmosphere of the waiting room can be a big deal. If you walk in and it looks just completely clinical, it's like I'm too young to be here. I'm a little scared right now. I think just having a welcoming environment when you walk in is making the situation a lot easier to go through and get through.
Thank you.
Yeah, like if I were to first walk in and somebody would like smile at me and maybe like sort of tell me what's going to go on through my visit, because something that really stresses me out is when I don't know what's going to happen because I don't know if maybe there's going to be a shot or something because I don't do well with shots, but I just kind of want to know what's going to happen from the start.
Yes. And I think even some of you have touched on like eye contact, saying hi. So that's what I was hearing when you all were talking. So thank you. Next question. What should front desk staff know about interacting with youth?
Yeah, so I think to just keep it light, like be really positive because you like kind of feed off of the person you're talking to's energy. So if they're in a bad mood and you're already iffy about it, then you're not gonna be very like, yeah, let's go for it, like type thing.
Just saying hi when I get in, even, I mean, I might be across the room, but at least like making eye contact or acknowledging I'm in there. A lot of the times I think it's scary just like knowing where to go since it's not going to be like posted on the wall directions on where you're supposed to be going. So just like having an acknowledgement so you know what to do and where to go when you first get there.
Thank you. I also want to add that sometimes even just going to your appointment alone, you can easily, if you are nervous or anxious, you can easily look over any directions or anything that may be obvious. I do that as an adult, so to this day. So I remember being a teen and being like, oh, oops, sorry. So it's just like being very gracious is what I hear you say.
Even the simple question, how are you? Because showing that you have genuine interest makes us feel better. And also at the end of the day is we're not just patients, we're also humans. And that question can make people's days for sure.
Not just a number. Thank you.
Yeah, I also wanted to add like I feel like it feels a lot better when you can feel that they have genuine interest in what you like have to say or like about you. Like I know none of you guys are counselors, but like from my from my experience, I'll have like school counselors at school and maybe like the first week or 2 weeks when you're talking to them, it feels like they have genuine interest, but after you like more get to know them, they kind of like lay off of it and it feels more like they're not trying to connect with you. So just try to make sure that you're nice the whole time type thing.
And then also, not assuming that we know everything about where we're coming. You might work there, but we don't. And I guarantee you we're not like on our phones researching everything about this clinic before we show up. We're just trying to get this treatment and get out of there. So just knowing that we're still kids and we don't have all the knowledge you do about this place.
Thank you. That was great. Okay. The next section and question I have is about during the visit. What language or questions feel judgmental, even if the provider doesn't mean them that way?
Any questions that are posed more as assumptions rather than true questions can feel more targeted, like you're already putting an assumption on top of us, already judging us without really getting the whole backstory. I think that puts you down, just like knowing that there's already a judgment between you two, and it closes you off more. You don't really want to answer the question as honestly as you would before.
Thank you.
I agree. I also think just not verbal, but nonverbals, because body language or blank stares, or saying nothing after I disclose information makes me just feel dismissed. And especially being an introvert, I'm an observer. So when I see someone, I'm definitely noticing those nonverbal social cues.
Thank you for touching on that. That's
Yeah.
huge. Awesome. So we're going to move on to the next question. How can providers ask about sexual behavior in a way that feels respectful and normal, which I think you guys kind of touched on, but yeah.
Yeah, so I feel like when adults try to talk about like sexual behaviors, they'll make like a joke out of it to try to make it seem normal, but sometimes it's just like it is kind of serious, so that's not something you want to joke about. So just be like more just like not joking, but like normal. You know what I mean?
Say it straight to you.
Also, when things feel dismissed and generalized, like if a provider says all youth feel that way or everyone thinks that way, if something is really bugging you, you definitely do not want to be hearing those things.
Thank you for sharing that. Okay, next question. I feel like this is going so like when we practiced, it was like woo, like this is great. You guys are doing great. So, so sorry if we're going a little fast, but I'm having a great time up here. What helps you feel comfortable asking questions or admitting you don't know something?
Usually when I don't understand something, I kind of have a face, kind of like I don't know what you're talking about. And when people notice that face and check in about it, I appreciate that. Again, being an introvert, I don't always say or communicate that I'm confused. Yeah, so just check my face and body language.
Thank you.
Yeah, like I touched on earlier, just making sure you're positive and open and kind because for everybody, I feel like it's hard to admit when you don't know something. So to be open, it makes it easier and makes it not feel like you're being judged.
Yeah, as Ella just said, it's hard to admit you don't know something, especially when it's someone you're not really exactly close with. So just literally, you could just tell us that it's okay if you don't know the answer to something, or that there's just no bad questions. Anything above that sort, it just makes it more comfortable to admit, like, I don't know. I don't have an answer for that.
I appreciate that. Thank you. Next question. How can clinics better serve youth who don't feel represented or respected in healthcare spaces?
Yeah, so I feel like if somebody doesn't feel like represented in the healthcare space, it's just you can probably be able to tell that by how they're showing up, like their body language. That's how you can kind of gauge who feels that way or not. But if you do feel like they feel that way, then just try to show extra care and show them that you do respect them and you do care about them. And just make sure you treat every patient the same, no matter how they look, because, everybody deserves that.
Period.
I also think representation matters. There's a history of racism in healthcare. So don't have a bunch of people working that look the exact same. if everyone has the same skin color and stuff like that, then youth will definitely not feel comfortable.
Thank you for touching on that. It's very huge. Thank you. Okay. So sorry, Jana. I looked at you, but right. So, next question. Let's talk about confidentiality and trust. What do youth worry most about when it comes to confidentiality?
For sure, our parents, or that maybe we said something to you and you hadn't told us that you had to tell our parents or something like that. So if we do end up saying something that you for sure need to tell them, maybe let us know just so we can prep ourselves.
Um, and then also maybe touch point at the beginning of each appointment about policies, because if you're doing that at the end, then it's like I already shared stuff that I didn't feel comfortable you sharing with others. So I think touching point at the beginning is very important.
Thank you.
Yeah, I completely agree with that. Not everyone can remember your long list of confidentiality policies and procedures and whatnot. So just reminding us of them, even just like the basic ones at the beginning, so we know what we want to share and what we maybe want to keep to ourselves.
I appreciate that. Thank you. Okay. The next question we have is, how should providers explain confidentiality so it is clear what is covered and not covered?
Definitely explain it in a way that's not overly technical. A lot of big words and stuff really is not going to get through to a teen, at least in my opinion. I'm not going to be sitting there and listening to all these like textbook definition policies straight from your guidelines and guidebooks. So just like putting it in terms that we can understand, and sometimes just hearing it like by the definition isn't very helpful. So maybe giving an example of what might you have to tell my parents or what could be covered under confidentiality.
Thank you.
Yeah, so also if you see that a teen is starting to talk about something really personal or they're about to, you could probably just like stop them and like explain to them the confidentiality rules before, because if you don't, it could make them not want to come back, but if you were, they could trust you way better and it would make them open up to you even more.
Yes, exactly. Especially that last part. Thank you. Next question. What can a provider do to make you, did I just touch on that? I'm so sorry. We're actually at the, oh my goodness, this is so fast. Like, oh my gosh. I was like, okay. Um, After the visit, y'all, follow-ups, results, and retention. What is the best way to receive test results?
I think it depends on the person. And it probably depends on what kind of test results as well. Some might be better to talk about in person, whereas some a text will suffice. Especially if they're more confident in sensitive subjects, that should definitely be shared in person.
Exactly what Neela just said. I think it's different for each person. Everyone has a different preferred way of receiving stuff. And I also think letting us know that there's options, because if I'm not told, I'm just going to assume the way you give me is the only way I can get results. So letting us know that there are more than just one option and you can choose which way you want results.
Yeah, totally. But like for me, I probably just want like a text message and keep the language simple, just so cuz like the phone gets pretty like cramped with a bunch of emails and a bunch of text messages. So if it's just clear and simple, it's easier for us to keep track of it and stuff like that.
Thank you. I actually did skip over a question, so I was not wrong. And I was like, I was reading it, and I was like, no, you should all hear their responses to this. We're just going to take it back to that question above. What can a provider do to make you comfortable in sharing information that may not be covered by confidentiality?
Like I touched on earlier, just tell us why that is. So we have a good understanding of it and like when you're gonna tell them so we can be like, you know.
Yes, I agree with Ella. Transparency is everything. But also just the vibes. If you have a warm and welcoming environment, teens are definitely going to be more inclined to share more sensitive information.
Thank you.
Along with that environment, again, body language really is everything. Being attentive and like making eye contact or just like showing them that you're actually listening. And I also think not interrupting when you're sharing because like telling something sensitive like that can be hard and getting interrupted in the middle of what you're wanting to say can make it even harder. So just waiting and saving your questions until the end can be quite helpful just to get through what you want to say first.
Thank you for that. Okay. Next question we have is what follow-up communication feels supportive rather than annoying?
I think being overly pushy with it, I personally don't like getting message after message after message after message. That's just more stuff for me to look at, and I am pretty busy with school. So just like having it enough that I remember to look at it, but not being so aggressive with trying to reach out.
I definitely think the same thing goes for calls. If you call once and the person doesn't answer, just leave a voicemail. And also remember to leave a voicemail because I will not be calling back a number I do not know.
Which is fair. Thank you. Okay. Next question I have is what would make you come back to the same clinic?
If everybody was just super nice and things were well explained and like they tell me like what is going to happen while I'm there, then I would probably be more inclined to come back. Yeah.
If I feel better than when I came in.
Yep.
Clear communication throughout the whole process. So not just having like clear communication only when you come in or clear communication only when you're with your actual provider. Having it throughout the whole visit from start to end, completing your treatment, not just like bits and pieces here and there.
Thank you. Thank you for that. Okay, next question is what makes youth drop off after one visit?
If I felt like maybe the provider like didn't really care about me or was judging me, or like maybe there was a comment that was a little bit rude or like something like that, I feel like teens get off put very easily. So that then they just probably wouldn't because it's kind of hard to go in the first place. So yeah.
And then kind of what I touched on my last answer, if I didn't feel like it benefited me, if I felt worse than after coming in rather than better.
Thank you. Our next section, and as we wrap up, let's just close up with some advice to providers. What's one thing you wish every provider here would start doing tomorrow?
Treat us like people, not just kids. Especially we are youth and we're gonna be adults sooner rather than later.
Thank you.
To probably actually care about your clients and treat them as individuals because we're not all the same.
Thank you.
Treating us like acknowledging we're still kids, but still treating us that we're capable like adults. I think if I had the initiative to take myself and sign myself up to go to an STI clinic in the first place and figure this all out on my own, I think that's more than deserving of being treated like I can handle my own care.
100%. I love that. Thank you. Okay. This is pretty much our time for any of you to ask questions. We're missing another. That's okay. That's okay. Oh, yes. It's at the bottom, of course. And guys, this is also highlighted and I still skipped over it. What's one thing clinics should stop doing immediately? Which these are really great.
I think I already said this. But again, any scare tactics in advertisement or even like in the clinic, like a lot of the times they have posters on the walls and having like, did you know you can die from gonorrhea on the wall is probably not going to be like the most welcoming environment. So just not using any scare tactics.
Thank you. Yes.
Like what I touched on earlier, just making sure youth don't feel judged when they come to your visit.
Generalizing because everyone is different.
Really sure what I was saying here. So all good. I don't know how that applies. Just make sure you're warm and welcoming when we come in and acknowledge us with a positive attitude. The welcoming is a big part. I think healthcare, a big part of even just like working a front desk job is customer service. Even if it might not be advertised like that, it still is really customer service. So just put on a smile, even if you've had a long day, it can make your patient feel a lot better.
100%. Thank you. Okay. Yeah, questions.
Thank you so much. You have some really nice comments online. I can read a couple, but here's a question. I want to reframe for just a second because there's a large part of our audience that are public health nurses. Okay, so they work in a health department, local health department, city and county health departments, and they follow up with the reports that come in because it's required to be reported if people get sexually transmitted infections. And we deal mostly with the bacterial, well, in our particular area, we deal with bacterial, curable, preventable sexually transmitted infections. So I'm going to talk about gonorrhea and chlamydia specifically. That's a large part, and many of those infections that are reported to us are in the youth population. And so that's oftentimes what they are doing. So they get a report in, and then they have to follow up with the person, whoever they might be, to make sure that they were properly tested and treated, that they understand the infection, that if they answer any questions that a physician couldn't, right? So public health cares about like the whole population, not just the one individual patient like a doctor might, but so we talk about the whole population. And so then our next portion is to make sure any partners are tested and treated. Okay. And that can be done in different ways where there's expedited partner therapy where you people could be given prescriptions where a partner can just go to a clinic, or excuse me, go into a pharmacy and pick up a prescription. Okay, so they don't get tested, they just get the prescription to cover in case they've been exposed to an infection, or else public health staff are asking people who have infections, who are their partners? How do I get a hold of them? What's the person's name? When's the last time you had sex with them? How often? Blah, 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 blah. So we ask those kind of questions of people to make sure that we know who may have been exposed and then confidentially notify those people, and so they work for youth to make sure the partners are tested and treated because you don't want to get it back again, right? That's what we're trying to prevent, reinfection to the original person and make sure everybody's tested and treated. Okay, so I say all that because so they're not all clinical staff. So these are folks who, raise your hands, are texting or calling youth on the telephone. And we're the people that are like, hey, call us back from the health department. We really care about you. Please talk to me. So you might get a text, right? Youth might get a text, or a phone call, right? Voicemail. Who sends out letters? Letters in the mail, actual mail? Like maybe get a hold of the nurse at the high school to call you down to her office to talk confidentially on the phone. So it's all confidential, of course, and your parents and guardians don't need consent for that as well, So given that scenario, these people who want to get a hold of you, all young people, what advice would you give them for the text, the phone call, or the letter they send to say, hey, I just want to talk to you because I care about you?
Okay, so I think that maybe first, start with the text message, a call, and if that doesn't work, then I think the nurse thing is probably a good idea because it's confidential. I would probably go for the letter last, just because I feel like that is the easiest way to get like other people to see, and they're like, Yeah, and then you probably get in trouble from your parents because why do they have to send you a letter? You're like, you're not answering, and then so I would probably do the letter last. But do you guys want to?
And to remind you also that whatever text and or phone call or voice message or letter, that it doesn't say anything about the infection. It just says, hey, there's important health information we have for you. Could you please call us back? Right. So that thankfully it doesn't have,
Yeah.
it doesn't break the confidentiality, but you're right. People go, why are you getting this letter, honey? Right.
Yeah.
Okay.
I think approaching it again with like a good introduction of yourself. If it's gonna be a phone call, I pick up a random number for some reason, I'm gonna be like, "Who are you?" So why are you calling me? So a good introduction, tell me why you're calling me in the first place, but still like it's gonna be hard to have a connection, but still be nice with it.
Yeah, because I think you specifically spoke about body language and listening and and attentiveness, and these folks have to do it over the telephone, which is harder. They can't lean in and say, so it's harder for them to express that on a phone call.
Definitely tone of voice because I don't know, especially for me, phone calls are still scary. So, yeah, tone of voice. If you're warm over the phone, that means a lot.
Yeah, and even if you don't mean to, if it's like a monotone voice, that can also kind of seem like not not happy, I guess, like not in a kind way, even if you don't mean it like that. But yeah, do you guys?
Okay, thank you. And I'm not sure if anyone in the audience here has a question. I also wanted to talk about their social media. Oh, we got lots of questions. But we'll talk about social media in just a sec.
Would there be anything in the conversation that would make you more comfortable giving your partner's information so that we can contact them? Because I could see with my own child, that would be like, I'm not giving that information out to somebody I don't know and I can't physically see.
Yeah. I think probably just explaining over the phone that like what you guys are kind of going to say to them and that like they're not going to get in trouble because I think for me at least like if I was about to give like my boyfriend's number out to like a random stranger, I'd be like, especially if I thought it was going to get them in trouble. So I just want to make sure that like it wasn't going to get them in trouble in any sort of way. Yeah.
My question's related to what she was talking about with the health departments following up. Do you, and I know it's hard to like think back because when we talk about STI education in schools, was that ever covered in your sexual health education in schools that the health department would follow up? Okay, love that.
Yeah. I think also because COVID kind of came around
Yeah.
when we were like in 5th, 6th grade.
Okay.
I think that's when it was taught a lot and we just weren't there, so they didn't really cover it online. So
Okay.
we never
'Cause
really got that.
I love that because I'm one of the people that goes in and talks about STIs. We do it at 7th grade in our community. And I do mention, I'm like, if you do test positive, the health department will follow up. Like, please call them back. I just didn't know if there was anything along those lines, how we could help you know that this could be coming if that happens.
Definitely whatever you do going in to actually tell, because I think personally for me, we had health in 7th grade and then freshman year. And 7th grade, it's touched on very briefly. 9th grade, it's a little bit more in depth, but it's not comprehensive enough that they would go on to talk about how you're going to be reached out to if you get a positive result.
And looking back, I don't remember any talk of the human health department. Yeah.
Mhm. Yeah.
Yes.
It's like-
Yeah, I just have follow up. I think what really is the best case scenario, because you're right, what you learn in 7th grade, you might not remember, and it's all new and it kind of blurs together. But what I have found most helpful is when the provider does the test And if it comes back positive, that nurse is going to contact you and say the test came back positive. If they can say to you, and I also want you to know that public health will be reaching out to you, they're obligated to do that. I kind of don't want to say by law because that sounds really heavy and scary, but just say that public health is going to follow up with you to make sure that you've got treatment, you've got your questions answered, and who else needs to be tested and treated. So that way you're like, okay, you got my attention. You just told me I have chlamydia. Now you're telling me someone's going to call me to follow up, and then my partner has to get treated. So that's in the forefront for you. So I don't know that many providers do it, but anytime I'm on the phone with that nurse at the provider office, I say, and please tell them that we're going to be contacting them. So you will, call us back. The other thing is we've heard a lot that teens don't check their voicemails. I don't know if that's true. So sometimes when we do leave messages, we don't know if you're just not calling back, you haven't checked. So that's where you're going to generate a letter, because we have to do our job to make sure someone's been treated to stop that transmission. But again, if we don't hear from you, we can't assume why you're not calling us back. And the last thing I'd want to say is that when that provider tells you you're positive, you always have that option to call the health department at that time so they don't try to call you. Do you know what I mean? So they're not calling you, or your parents pick up a phone or they see something. That's an option. And I don't know if that's taught through Patch, but it's a way to kind of protect your confidentiality.
Yeah, you totally had the same exact thought that I did, because we would love it if providers would give us a warm handoff in public health and say, hey, yes, this will happen if you have a positive, and here's the health department's number. Give them a call if you'd like to just reach out yourself or whatever. And I think some of that happens in an STI clinic and or the family planning clinics. That where they're more knowledgeable or more close to that. But yeah, I think most providers do not just let you know about us in public health, right? And so we're just cold calling, and yeah, so any advice you can give us.
Yeah, I think that's super helpful to know. It's just because like I don't think I've like I know what STI is, but like before patch for sure or before any of this, I like don't know anything further at all. So I think it's just great for that to be more like further known, like to more people. And it's great that like the letter is like last, because obviously sometimes you have to do what you have to do, but as long as it's like not first case scenario type thing.
Yeah, I think with trying to reach out, good with the letter being last, because I would do anything to not get a letter in the mail. My parents are very nosy and they'd be like, "Gianna, what'd you get in the mail? What'd you open? It's your name's on the mail." And I wouldn't want to share that. So I think having that as the last resort, and then also good for giving the option to call yourself, because we're still in school and I'm not sure when you would be calling, but getting a call in school isn't usually very good. And then it's the end of the school day, I'm tired, and I'm not going to remember to call you back. So having the option to call you myself at first and just get it over with, get it done. I already know what I'm going to say. So just being able to have that in my control instead of sitting there waiting for a phone call and be like, "Ooh, I'm nervous when I'm going to get this phone call."
That is a really good point. That is a fantastic point. Thank you. All of you have provided a lot of good information. I'm going to ask about social media. You say that you maybe look at things online. I don't know what you're using these days. Not Instagram. Is that old news or what is
Instagram,
it's still on
TikTok.
Instagram? Okay. But some health departments are like the state health department does have an Instagram page, and some health departments have their little page, and so we make social media posts, right? And it's like, hey, make sure you get tested, blah, 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 or whatever, talk to your partners. Does anybody really read who's looking at that? Who's looking at the state health department or or the Eau Claire County, what your social media? So do you look at things like that? And is that messaging getting to the youth when we put stuff online from our health departments?
I personally don't think I have ever seen an Instagram post from any public health department on my
You need to
page.
start looking. No. We have some out there. See if you like them.
But I think if I were to see something, I think it all depends on how you, I guess, market it, because you're not really marketing anything. But I'm not going to stop to look at like some black and white picture that says go get tested today. At least having something eye-catching on the post, that makes me want to at least like stop or give it a second thought.
Yeah, I agree. And then also, like, okay, for me, I guess if I am thinking about going into some kind of health clinic or something's like I think is wrong, I'll look it up. And if I do, I'll see a post, you know what I mean? And I like it when it's like colorful and stuff like that. Just makes like, I don't, me personally, I prefer when it doesn't have like, there's some of those like health puns that people put in. It's like, I see that, I'm like, oh, never mind. Like, but it can be
Uh-oh,
colorful and
because we
stuff.
use
but-
them. We use that sometimes.
I also think it does depend on the person's feed because obviously our phones feed us stuff that we want to see. For me, I follow Planned Parenthood, so I'll get like the get tested and that kind of reminders from there. Yeah.
Okay. Another question. What motivates young people to get tested in the first place? Would it be knowing facts about STIs, thinking about partners, hearing rumors, or just knowing someone else was positive, or you thinking you have symptoms? I don't know, any of those whole host of things. Is that what would motivate you to go somewhere to to a clinic that is not your regular doctor's office, but maybe, a family planning clinic or a Planned Parenthood or an STI clinic in your health department if you have one? Anything like that?
For me, something that motivates me is definitely my future. Obviously, STIs can affect having kids and that kind of thing. So obviously, I want to be a mom someday. So I think stuff like that motivates me.
Yeah, I also think just like probably probably knowing what will happen if it like goes untreated or stuff like that, or also like cuz like if it goes untreated or it's something that like other people can notice, cuz I know like in school if somebody has a STI it's like oh everybody's talking about it, and like it's like weird cuz like I don't even know if all of them are contagious, but everybody acts like they're all contagious, and then like nobody will go by you. So you want to make sure that nobody thinks you have that. So I would want to know before people start thinking I have it if I don't even know I have it.
I think to actually get me into the clinic would be a good website. You have to find the clinic somehow, and if you're clicking onto a website that looks like a little sketchy, it's not very colorful, kind of hard to navigate. I'm not going to want to go to that one. I'm going to look for something that looks appealing and better, because I think like a boring website is going to make me think it's a boring clinic and it's not going to provide me good care. Whereas like a colorful page and easy to navigate, easy to find information on, that's gonna draw me in more than the other one would. Yeah.
I just want to say you guys had great responses. That was great.
Awesome. Yes, fantastic. Another question. Um, the person says, "Great job, Patch. Are you often an educator for your friends and peers around you regarding or around regard? Excuse me, I'm messing that up. Regarding sexual health, or do your schools talk openly about it? So, are you all doing peer education?"
Like among my friends, I've brought a few things that I've learned in Patch into a conversation, just like casually, but it's not like I'm going around telling people in my school, like straight from my provider workbook, that you can like go in and get yourself tested and still have confidentiality about it.
Yeah, I totally agree on what she said. Yeah, I feel like a lot of us like, because not a lot of people know the type of stuff that we get taught in Patch, because all the school stuff is very like surface level, or it's stuff that, it's like 5 minutes every day when we have 8-hour days every day, every week. So it's kind of hard to remember that little sliver of a moment. But I do feel like Patch is helpful and it helps me to educate my friends on like dangers and stuff like that.
It definitely has made me feel more educated and confident. Um, I'm definitely, I think, a person that a lot of my friends go to when they need advice or stuff like that. And one of my favorite questions is like, what is Patch? Because I'll get asked that because not a lot of people know. And then I get to tell them, like, oh, it's this amazing organization where I get to educate and advocate.
And do you think when you speak to your peers that they see you as an expert, or, like they listen to your expertise more than they would someone else in school?
Yes.
Yeah.
Yes.
That's fantastic.
I think so, not only because of like the patch thing, but also because when I say stuff, I feel like they can look it up after I say it and it is like factual. So it's more like their trust in us, I guess, because the things we're saying like aren't lies, I guess.
Okay, thanks. Another question. Where can clinics advertise to youth besides on social media? So like where in the community do you spend a lot of time that if they were putting up posters or other advertising?
I think probably at just like I know a lot of places like don't put up posters. Like if Starbucks put up posters, then that would be a great place. But I know they don't. So I know there are a lot of posters in the school halls and I look at them, but some people don't. But like for me, I guess the only place I could think of is like school halls and stuff like that.
Yeah, I agree with school because that's where we spend most of our time.
And if there was a QR code on the poster to bring you to a website from public health that tells you more information, would you click on it?
Yes, that'd be
And read-
easier than just a URL or something like that.
Okay. Okay.
Yeah, I agree.
I think, yeah, I don't know what I think I forgot.
The question was that like where in the community do you hang out that
Oh.
if they were going to put up a poster or
Yes.
like if there was some advertising at some community
This might
site.
be an odd place, but I like to go to the library, and a lot of the time libraries have really big bulletin boards right at the entrance, and I love to look at posters. I will stand there and look at all of the posters and all of the little clippings you can take off the bulletin board. So I would put some in some libraries.
A good idea. And because public health, you know, right there in a county or city administration, may have access to their libraries. So that's pretty cool.
I wanted to add, do you guys ever see posters in the bathrooms? Like, and or when you guys need a break from your classes, do you go to the bathroom and you're just kind of like, okay. And do you ever see posters in there in the stalls or look? Because I don't want to shy away from the fact that people do take their phones in the bathroom. So, like, scanning a QR code in that area, is that something you guys would do?
I would personally rather scan a QR code in a bathroom than I would in like a school hallway. You have a lot of peers in the school hallway, and if I'm scanning a poster about STI information, that might like bring up some signs of like why is she scanning a poster about STI information? So I think bathrooms is a more like secluded place where you might feel more comfortable scanning that.
Yeah, I totally agree. But my school, we don't do posters in bathrooms, so I think just some schools don't do that.
Yeah, I don't think I have any posters in my school's bathroom either, but I like that idea because obviously I don't want to be standing in the hallway because it's kind of obvious when you're trying to scan a QR code. So
I might already know the answer to this. I have a feeling, but I just wanted to ask and get your opinion on it. So, our social media team for our sexual health clinic, and I want to know if this is cringe or not, but they do like all of our advertising for our sexual health clinic. They'll put that it's a sexual health clinic like in the text box, but like in the like on Facebook or whatever above the image, but on the image it'll be like a couple and then it'll say like it says if you know you know, but like the abbreviated version and that's it. And they think it's like people get it, but I feel like people don't get it or it's cringe. So like thoughts on that.
I definitely would not have gotten that. Yeah.
That's what I thought.
Yeah.
Yeah, I don't think I know, but maybe if you had like the STI like part or whatever what it was bigger like on it as well if you really wanted to do that, but like yeah, I wouldn't know.
I personally read the captions of stuff. So I think as long as it's like put in the caption, the first thing I can read is that it's for specifically for a clinic. I think I could connect the dots there. But if it's not apparent and I have to like click on the caption and like scroll all the way down,
Yeah.
that might make it a little bit more confusing.
Okay. Thank you. That's helpful to know. Also, I know you just answered that too, but like, do you guys read captions and stuff? You say that you do, but like, does everybody or do most people just like look at the graphic and scroll?
Well, I'm not really on Instagram as much, but like on TikTok, I for sure look at the caption.
Okay.
I feel like when I'm just scrolling, I'll like quickly look at the photos. And then like if I'm confused about something or want to learn more, I will look at the captions.
Okay. Thank you. That's really helpful.
Oh, we have a couple more questions. I'm gonna go here first.
Hi, Patchies. You guys did amazing job. Thank you for your expertise today. And my question for you guys is specifically individually, but also things that you might have heard amongst your peers, whether at school or whether you guys are giving education. What kinds of community events are interesting to teens, or do teens like want to or like to go to?
Personally in my school, if there's like food there, if they know there's gonna be food there, then they'll probably go. And then I don't know. I mean, our school doesn't really have events other than like school dances, so I don't know how you would incorporate that. But the only thing people will go to is food or school dances because they can get dressed up and stuff.
Okay. So, sorry, just a quick follow up. That was great to know. Thank you. The reason I'm asking is because we are always trying to do different community events to get youth engaged, but also to get everybody in the community engaged for like all the different programs that we do just for education. And so things we've done in the past are like paint and sip at the library. And there weren't a lot of young people there. So other than school, do you feel like it's kind of just hard to get engaged? Or do you think, sorry, this is like too many questions at once. So anyway, okay, never mind. That was great. Thank you. Thank you.
To touch on that, I remember like my mom would always like tell me about different things going on in the library. She still will do that once in a while. Like, oh, this sounds fun. Do you want to do that? So you must have just not gotten the right group of people because I definitely would have signed up for that.
This kind of goes with it, kind of doesn't. But I know it's annoying for some people, but for me, it's helpful. Like when stuff like that in the community is like going on, when they send an email to like, because at least in my school, like the kids' email and the parents' email are kind of connected. And whenever like my family sees something like that, they're like, Ella, oh my gosh, you need to do this. And it's annoying for some people, but for me, it's helpful because otherwise I wouldn't even know what was going on.
Yes, thank you. I'm just wondering, in your experience or in your peers' experience, if you're looking for information about STIs or other sexual health related things, where are you going? Are you Googling this? Are you looking on TikTok? What are your resources?
Um, this is probably really bad, but most of the time I look it up on TikTok first because I don't know, I guess I just see like other people my age and how they think about it. But secondly, I'll just look it up on Google, but I don't think I would ever go to anybody like in person.
Again, really bad, but definitely Google and the AI when it first, yeah.
Definitely Google. I think it's like the easiest way to access any sort of information, especially since it might just like literally be in our back pocket at all times. So definitely Google.
Another question.
To kind of follow up on that, how are you determining if it's accurate information or not? I know there's a large issue with false information on TikTok. So I don't know, like, do you have a way that we as professionals can help mitigate that? Or do you guys are like, I saw it on a TikTok, I believe what I believe?
I usually always go for like websites that I really know. So like the top three I could think of are like Cleveland Clinic, like Marshfield, anything with like .gov at the end. Anything that like I personally know is credible. I try to stay away from the AI overview because I know it can like pull random fake information from any website, but having it at the top makes it hard to like not look at that first. But I usually go to like the websites that I know are credible first before clicking on to some random like blog.
This is probably pretty bad, but I do whatever the first thing I see. But something that I think would be probably helpful is if it was taught more in schools, because if I were to see something, and most of the time I would automatically think like, yeah, that's probably right. But if I were to see something and then I would remember something I heard from school and they don't add up, then I would probably do more research, but probably just getting it more into schools.
Yeah, I kind of do the same thing as Gianna too. And then also, um, I'll see like the first thing, but then I keep scrolling to see if that's what others are saying too. Just like because a bigger number, obviously, then I believe it more.
Other questions? Oops, over there. I didn't see.
I just want to say thank you guys so much for all this information. This is amazing. So I really appreciate, I think we all really appreciate it. So thank you. I have a question for you guys. So, when looking for a clinic or when you're on social media, I know many health departments are trying to use Reels. Would Reels or like YouTube Shorts, what are you guys' thoughts on that? Is that something that will make you say, maybe I do like that clinic, I'll go to it? Or do you prefer something more professional?
I definitely prefer something more professional. I feel like Instagram Reels and YouTube Shorts are like that's the type of place you go to if you want a laugh. Yeah.
Yeah. I've low-key like never been on Instagram Reels or or what is it? YouTube Shorts in my life. So if you wanted to go for something like that, I would for sure do TikTok. But yeah, probably something more professional if I like think I'm gonna like die or something.
I think it can be a mix of both. It doesn't have to be like strictly professional, but also still being able to incorporate like some humor or something relatable into it is gonna, at least for me, more likely get me to pay attention to it if it's something I could relate myself to.
Thank you.
From a couple questions ago, someone was bringing up education in the schools, and that's something our health department is aiming to be better at, proactive education, but I don't know how to best approach it because I know that we are people coming into the schools that no one at the schools knows. So I want to make sure that our information is trustworthy and that it's what you're wanting to learn about. Any ideas on that?
I personally like stories. So for we went over like drugs and stuff a lot and alcohol for like a big unit of our freshman gym. And they brought in someone who like had firsthand experience with like drug abuse and abusive parents and alcohol abuse. And it was something that I actually listened to. I found it interesting to be able to hear a firsthand experience. Even like just a story in general, I think captures more attention than simply reading off a slide or putting up a slide with statistics on it and just having us look at that. So having something that you can connect more to than just numbers and facts.
I completely agree. I remember in health class there were a couple of people who would come in and they would just get really like emotional about their story because it would be something personal, and I feel like that stuck with way more students than anything else could because people would come out actually being like, "Wow, like that was like," when most of the time people would just be sleeping. But I know it's really hard to do. But we had this speaker come in, and he wasn't speaking in our health class because a lot of students like they don't have health class all of the time. But he spoke to our whole school, and he had gone through like a story, like Gianna said, and it was just really impactful, and it had a lot of people thinking. So I know it's hard to like cooperate because you have to get the whole school there, but I feel like stuff like that is helpful because not everybody is in a health class.
I agree with both of them 100% because facts are great, but the stories are definitely what sticks.
Who else in person here has a question? Anybody? I can't see online anymore. Ran out of battery. But there was a lot of stuff in the comments for you all. And I'm going to send you those comments because people were just saying, thank you so much for doing what you're doing. Excellent. Great answers. Blah, blah, blah. All kinds of good vibes your way. So we want to thank you for that. And anything else anyone has to add right now before we end with Patch? And we probably want to hear from Adele for a little bit at the end. Anything? You guys, thanks so much. A big applause. Online too. Online, show your applause. Fantastic.